Hello, everybody. My name is Dr. Wendy Sun, and I'm the second year administration fellow at the Yale School of Medicine. It is such a pleasure having Dr. Kamna Balhara as our education keynote for SAEM 25. Dr. Kamna Balhara is an associate professor of emergency medicine at Johns Hopkins, an associate professor of medicine, science, and the humanities at the Krieger School of Arts and Sciences at Hopkins. After obtaining a master's degree in French cultural studies from Columbia University, she completed medical school and residency at Johns Hopkins, serving as chief resident. Dr. Bahara is an innovator in the health humanities and has experience with implementing humanities curricula for medical students, residents, and faculty from across specialties. She is a founder and co-director of the Health Humanities at Hopkins EM Initiative, which offers social EM and humanities-based programming to institution, community, and national audiences. She has been invited to speak to national audiences on the humanities in medicine and was selected as a Harvard Macy Institute Art Museum-based Health Professions Education Fellow. Her work has been funded by the Association of American Medical Colleges, the Josiah Macy Foundation, the National Endowment for the Humanities, and the Emergency Medicine Foundation. She serves on the steering committee for the National Health Humanities Consortium and is a member of the editorial board of the SAM journal, Academic Emergency Medicine. So welcome, Dr. Balhara. Your work sits at the unique intersection of the health humanities and emergency medicine. Can you share what led you to this space and how your journey shaped your perspective on integrating the humanities into EM education and practice?
Well, thank you, first of all, for having me here. I'm so excited to have this amazing opportunity to share and talk about the health humanities, which is very near and dear to me, both personally and professionally. And I'll just say, the health humanities, people often wonder like medical humanities, health humanities, kind of, what's what. And health humanities is really this combines the disciplines of the arts and the humanities. So, not just arts and literature, but also, for instance, history or anthropology, and kind of brings in all these disciplines to help us sort of better understand both the individual experiences of giving and receiving healthcare, but also sort of the broader contexts of what impacts health and what guides healthcare. So, kind of diving into the past, I was a French major, and then I lived in Paris for a year and I got my master's in French. And my thesis looked at 19th century art and literature to think about how paintings and poetry sort of gave us a lens into understanding how women were treated and what their role was in society at that time. And, I loved the experience of engaging with different works of art or poetry. I mean, it was just fascinating. But on a broader level, it was really interesting to see how arts and humanities were not only a lens into understanding what's happened in the past and how that, impacts what's going on now, but often themselves served as a catalyst for effecting change in society. I was immersed in all this 19th century stuff, and then I came to medical school in Baltimore, and I was like, that part of my life is over. What does it have to do with medical school? And it's only sort of with hindsight, as I'm thinking about this, that it has so much to do with the practice of medicine, that ability to turn our eye beyond the walls of the hospital, to understand the factors that are impacting the health of our patients. And when I think about it, I really, at the heart of it, I think that's why I went into emergency medicine and why I was so drawn to it as a specialty was because in emergency medicine, I saw that the residents and the faculty, when I was rotating, were constantly navigating the space, right, between the hospital and the outside world. And I think as EM physicians, I saw that they had to be particularly cognizant of all the sort of quote unquote non-medical factors that impact the health of the person that they're caring for. And so everyone, they were amazing clinicians and fun people, but on top of that, almost everybody was like EM plus, right? They had knowledge or interests in fields that might have traditionally not been seen as medical. And I really loved that. And things sort of came full circle in my first job after residency as faculty, where I was engaged in humanities education for medical students. And it reconnected me both with sort of that individual joy and power of engagement for me personally with arts and humanities, but also kind of reintroduce that concept of like, how can we leverage these disciplines to better understand health and healthcare? And I really wanted to bring that to graduate medical education, to residents, to faculty. And when I returned to Hopkins, I was very lucky to have some incredible mentors, my amazing chair and our vice chair for education, who were so supportive of bringing the humanities into the residency curriculum. And of course, our residents who were so open to trying something new. So that's really sort of become the guiding principle of my career, is sort of meaningfully integrating the health humanities sort of across the spectrum of medical education and EM.
That's really wonderful. So you kind of alluded that, as emergency medicine physicians, we're a truly special cohort and, collaborated with other multiple specialties as well. I was kind of curious, what else about emergency medicine uniquely position us to rethink healthcare through this health humanities lens?
Yeah, so as we were talking about just now about sort of being the front door of the hospital, right? There's almost no other specialty that I almost feel like we have one door in the waiting room and one door out in the community. And I think we are constantly very explicitly exposed and have an understanding of the sort of factors beyond medical care that impact any given patient's presentation. And we are constantly interacting with structures outside of the hospital, right? Like with community organizations, with our first responders, with recovery centers in the neighborhood. And within the walls of the department, it's our patients, it's our caregivers, social work, peer recovery coaches, so not only are we constantly navigating the space between healthcare and sort of the outside world, but we're also inherently a very interdisciplinary specialty, a very collaborative specialty. So I think it's natural that we would potentially be leaders in sort of an interdisciplinary field of the health humanities, and especially in a field that asks us to look beyond the walls of the hospital when thinking about health and healthcare. And so we're really a natural fit for sort of navigating that space. And I will also say, I think, perhaps I'm generalizing, but I feel like from its inception, emergency medicine has represented innovation and a willingness to doing things differently. And as a specialty, we arose out of a need, right? Out of a very pervasive societal need. And I think that mission still guides us as a specialty. And we're also open to change, open to doing things differently, open to innovating, So I think we're really uniquely and positioned to really take their reins with the humanities.
Yeah, and I think, the healthcare humanities really offer a unique lens for critically examining some of the issues that we see in emergency medicine, such as healthcare inequities and the implications of artificial intelligence. How can we leverage humanities-based frameworks to better understand and address these challenges? And what role do you see emergency medicine physicians playing in shaping the ethical and equitable integration of AI in the patient care space?
Yeah, so those are obviously incredibly important and sort of hot button topics. And so I'm glad you brought them up. I think when talking about health disparities, I've been very lucky to work alongside, my colleague Nate Irvin, who is this just incredible leader in the space of social EM. And in collaborating with him and seeing the intersections between the humanities work that I've been doing, the social EM work that he's been doing, I think it's really opened my eyes to the ways in which the humanities could be leveraged for us to think about not only the individual interpersonal factors that might impact inequities in healthcare outcomes, but also the systems level factors that contribute to those. So you're thinking about it on an individual level, for instance, if you want to talk about how do you mitigate stigma around substance use or chronic pain or obesity, for instance. So a lot of visual arts-based methods and museum-based pedagogies are grounded in getting people to sort of in a safer space, right? Because you're talking about a work of art, not a patient. But to have that opportunity to think about your initial snap judgments, to think about your preconceptions, to potentially question or revise your assumptions. And so that's a really powerful tool to think about mitigating stigma. So folks have looked at museum-based education for bias around pain management. And in our program, we had a year-long humanities curriculum on substance use. And we leverage some of these pedagogies to discuss and potentially mitigate stigma towards patients with substance use disorders. But at like the broader level, for instance, understanding the historical origins of a problem is crucial to potentially thinking about solutions or truly understanding that problem. So when we talk about substance use, for instance, Baltimore has a high prevalence of opioid use, but it's impossible to fully understand that without also understanding how there was a similar issue in the 1960s, and there was an opioid epidemic in the 1960s in Baltimore that had very different origins but has very real repercussions today. So pulling in history is really crucial. And then I think so much of health disparities work is effective partnership with community stakeholders. And for that, cultural humility is a must. And so arts and humanities have been leveraged to get people to be open to new perspectives, to different interpretations. So that sort of openness is crucial to the cultural humility that's really at the heart of effective partnerships. So I think both from an individual to a systems level, it's a great lens and tool for thinking about health disparities. AI, for instance, I'll bring history into it again. I think the implications of AI can't be fully considered without an understanding of how technology has been integrated into medicine in the past. So I think it's really important to turn to history of medicine and science and technology studies, these arms of the health humanities, to understand, for instance, what lessons are there to be learned from the implementation of the electronic health record, right? When that first came out, that was kind of framed as a tool to alleviate administrative burden, to bring us back to the bedside. And I think many of us would agree that's not really what happened. So what happened there? Like, what are the pitfalls we can learn from to avoid replicating that with the implementation of AI? How do we prevent AI from becoming an administrative burden? How do we prevent it from becoming something that's solely leveraged for billing, for instance? And then, of course, the ethical considerations of AI. There's lots of people already doing incredible work at the intersection of EM and AI. And I think bringing in bioethics and humanities is a natural next step in enriching the conversation around ethical issues around transparency, surveillance, accessibility, and equity, as you brought up.
I love that throughout all of this, you have really concrete example and tools that, people can bring with them home. As burnout and moral injury are especially big concerns in emergency medicine. So how can the health humanities be used as a tool to support clinicians facing these challenges? And what concrete steps can residency programs take to integrate these principles into training that fosters long-term career fulfillment and well-being?
So, actually, that's some of where the strongest evidence is for the impacts of the arts and humanities amongst medical trainees and medical professionals is within the realms of impacts on self-reported burnout, on resilience, on grit, etc. And so well-being has really been the focus of many arts and humanities-based interventions that have been undertaken and studied. And so I always think of burnout and moral injury as sort of systemic issues that manifest with individual symptoms. So like we talked about with health disparities, there's the individual level factors and sort of the systemic factors. In this case, the gaps or the flaws or the issues in our systems of training, our systems of providing care that create an environment that it creates burnout or creates moral injury. And then we have sort of our individual, reaction to that and differing abilities to mitigate the impacts of burnout and moral injury. And again, I think that duality comes into play where the humanities gives us the tools for potentially building up a skill set that makes us more resilient as individuals and giving us frameworks or lenses to critically think about those bigger systems. So on an individual level, narrative medicine, creative writing, those can be leveraged for reflection, for introspection, museum visits and museum-based education. That's something we're leveraging in our program in our loneliness curriculum this year to generate community and generate connection and mitigate isolation that can sometimes be, so inherent to residency training. And then another really powerful impact, I think, of the arts and humanities is when you think about things through the lens of narrative and story. And Dr. Jay Baruch, who is an innovator in the humanities as applied to EM and a truly gifted writer, he has written a lot about how centering the patient's story, thinking about the narrative, can really put the patient back at the heart of our practice again and kind of draw our attention back to the patient, which in and of itself, I think, is core to folks' fulfillment in practicing emergency medicine. So those are sort of the individual level tools. But more broadly, humanities-based disciplines really ask us to think critically and to learn to sort of understand the cultural and historical context of the systems that we're in, but then also to ask questions or to think outside of the box when we're trying to understand a problem, not just look at it through the lens of med ed, look at it through the lens of history or ethnography or anthropology, to think about where solutions might lie. So I think that duality of self and system is really powerful.
Yeah, and certainly, with making a positive impact in the system, like, those changes are critically important. And we're in an era where data drives decision making. How do we measure the tangible impacts of integrating the health humanities into emergency medicine education practice? Are there existing metrics or research that demonstrate the effectiveness in improving clinician well-being or patient outcomes?
Yeah, so I'm glad you asked this question. I always struggle with it a little bit, and others, have written about it or talked about it extensively as well. This sort of tension between intrinsic value and value that can be measured with metrics that are familiar to us. So sometimes I wonder, how can you put a metric or a measurement on the joy or connection that someone might feel when discussing a work of art with a work colleague, or the sort of the richness of reflection or introspection or insights that engaging with the humanities might elicit, in someone, for instance, in residency. It's hard to put like a metric on that. But at the same time, the good news is that there is loads of evidence that supports the use of the arts and humanities in medical education. And this really robust evidence base is what has led organizations like the Association of American Medical Colleges, the WHO, the National Academies of Sciences, Engineering, and Medicine. They've all issued statements or handbooks on why the arts and humanities are crucial to medical education, all the way from pre-health professions like college students to physicians in practice with continuing faculty development. And so there's a wealth of evidence, both ranging from observational pre-post kinds of studies to randomized interventions that show the impacts of arts and humanities on individual learner attributes, skills, and knowledge. So there are multiple studies across disciplines in medicine that show impacts on observation skills, visual diagnosis skills, communication skills, on attributes like empathy, for instance, on attributes like the tolerance of ambiguity. For us, for instance, we are constantly grappling with uncertainty and ambiguity in emergency medicine. And we know that tolerance of ambiguity is linked both with physician well-being, and intolerance of uncertainty leads to higher hospitalization rates for unnecessary testing. But that's not really an attribute that we can really nourish with traditional pedagogy in medical education, right? And we already know that the humanities has these impacts on learners in enhancing their tolerance of ambiguity. So that's a really powerful example, I think, of an impact on an attribute that has very real clinical significance. And then, lots of evidence for the ability to revise one's idea on professional identity formation. So lots on sort of the individual level. But that line between individual attributes and skills and downstream impacts on patient outcomes, I will say I don't feel like that line is fully drawn yet. I mean, I think intuitively we know making someone more comfortable with uncertainty will hopefully impact their decision making in the clinical space. But we don't necessarily have evidence that shows that a humanities-based intervention will then lead to those downstream outcomes. But in a lot of spaces, the humanities are elective. They're an add-on. They're something that, a select group of people might do because they already have an interest. But in order to design an intervention and then measure its impact on patient outcomes, it needs to be something that's rigorously designed, longitudinal, structured, appropriately powered to detect impact. And we can't do that if our humanities interventions are just elective or sort of one-off. So I think that's an argument in favor of more structured integration of the humanities in emergency medicine education so that we can thoughtfully design curricular interventions that are aimed towards impacts directly on patients. What is the impact of a communication-focused humanities intervention around dealing with patients with specific pathologies, for instance, or talking to patients? I'll give you an example. How about you mentioned AI? And there's so much uncertainty in AI. So not only do we have to be able to navigate that uncertainty, we need to be able to communicate it to patients. We need to be able to effectively talk about AI to patients. So what if we designed a longitudinal humanities-based intervention that focused on ambiguity and focused on our ability to communicate that ambiguity, and then evaluated how that conversation with the patient went down the line? But again, that requires rigor and that requires longitudinal investment. So I really think that's a justification for that longitudinal investment so that we can generate the robust evidence on patient outcomes that I think many educators would be looking for.
Wow. So it sounds like, you and your colleagues have done amazing work in this space already, but there's an also a call for action that we need more people in this space and, for us to kind of connect the dots and really see how it translates out. So I'm kind of curious as we wrap up here for any folks who want to dive a little deeper before our annual conference, what resources do you have that people should visit to learn more about health humanities as intersects with emergency medicine?
Yeah, of course. I'm so glad you asked that because I think it's really important to state that engagement with the health humanities is not just for people who are art historians or artists or writers, right? I think engagement with the health humanities is beneficial across the spectrum of emergency medicine practice and across the different settings of emergency medicine. And so, a great starting point if you're at an institution that has a university affiliation is to reach out to people that are doing work in the humanities. A lot of schools have undergraduate programs that are medical or health humanities oriented. And so I think identifying partners with complementary expertise is so crucial. As a medical educator, seeking out someone who's working in the humanities space and kind of bringing in their expertise in designing curricular interventions, for instance. But it can be as simple as going to a neighborhood museum or a gallery or engaging with an arts offering in your community and identifying those resources that can potentially be leveraged towards educational interventions. There's loads of online resources for people that might be interested. The Health Humanities Consortium website is a really great place to start. It's an interdisciplinary community. NYU, for instance, has a database called the LitMed database that has this whole repository of art and literature that's relevant to healthcare. So there's loads of online resources. And for folks that are looking for more sort of robust development or more structured development, there's fellowships in art museum based education. There are training programs in narrative medicine where, that Columbia is really a pioneer in. In our program, we just started the Health Humanities Fellowship. So we have our first fellow this year who's working on humanities and medical education. So there's lots of training opportunities as well. So I think there's opportunities for really robust structured training, but also for individual engagement. And, I would encourage people to get out there with their work colleagues, maybe with their co-faculty or take your residence and go look at a mural in your neighborhood. And I think the insights that'll generate, not just about ourselves, but about our colleagues, about the patients and the neighborhoods that we serve, those are invaluable. And that's a resource that's, right outside our door somewhere. So I think this is for everyone. And there's plenty of amazing partners and people with expertise in different disciplines who are an incredible resource.
Wow, what a wonderful message to end on, that health humanities is for everybody. And with that, it has been an absolute pleasure chatting with you, Dr. Balhara. We look forward to your keynote at our SAM 25 annual meeting. See you in Philadelphia.
Thank you. I'm looking forward to it.